All right, so March 24th, we had our March 22nd, since TB Day is the 24th, we had our education summit. This is a picture of not quite all the 155 people who showed up. The room is actually 3 times larger than this. Next slide. So funding obviously came from T, and then a tiny bit of the funding also came from the County of San Diego. So the details, and here you have pictures just to kind of show you an idea of how things looked. We had 155 attendees that included teens who have a tuberculosis specific club at their school. There were 37 different organizations, 67 healthcare providers, doctors and nurses, all different kinds of organizations, which one of the types that isn't mentioned, even though it says healthcare, is health plans. So it was a nice combination of people. And we also had a binational group that was there who did art for us during the event. I think in the lowest picture on the bottom, you see myself and another person holding 2 small canvases. So the artist from Mexico, who is associated with the health minister, was kind of assigned, I don't know what word to use, but he is now the tuberculosis ambassador from an art perspective. So he and another gentleman from an international group were there as well, because they happened to be doing large murals at a couple of locations in San Diego County. So that was fun. You know, that was kind of like an added treat for people. You can't tell from here, but the lady at the bottom who's holding the canvas that looks like a lung, you see how there's like tiny little dots all the way around? Those are the people's thumbprints who were there at the event. So you put your, thumb into some paint and you put it on. So it was very, very, I don't know, I really liked it. People were all excited about it, like, oh, I want to do it, I want to do it. So, we had some fun too, which was nice. Okay, next slide, please. So I'm not going to go into the detail. I know you can read. So the first half of the session was really provider oriented. And thank you to the County of San Diego Tuberculosis Elimination Initiative for corralling all these folks together, these experts, to present the various information, with LTBI being the most important part of it, the emphasis. I think what I took away from this part of the presentation, and what I heard others take away, was if you were a provider, a physician or a nurse, you got all the up-to-date information. During the expert panel, they did case studies. You could ask questions as to why, one physician thought of it this way, another physician thought of it that way, as to how to address a patient's diagnosis and treatment. People were engaged. You didn't have to be a doctor or a nurse to understand what was being said. You knew AGRA was the test that needed to be taken. You knew that just because you had a screening test and you tested positive, that wasn't the stop for LTBI and the kind of education that needed to be put forward. So it was very interesting. I was part of the key takeaways for the morning session with 2 other physicians, and we really, I think the most important thing that was said is, if you test, you need to treat, period. There cannot be, oh, we're educating folks, and yes, we can screen them, but if you're going to test them, you really need to follow through on treatment, and that has to be topmost of mind with providers. Next slide. And so then there was the afternoon session, which we facilitated, and it was quite exciting. we had a panel, and they spoke, and one of the grantees, Asian Pacific Health Foundation, they presented. So Jackie Kuhn from Somos TB did a testimonial via video of, what it felt like, resources, testing, treatment, what it all meant. And so I think it took what happened with the providers and put it in the perspective of, who's this all about? It's all about the individual patient, right? So that was a really nice intro. We had small group breakout sessions and a large group discussion from all of this. Our contractor who does presentations for us and facilitates, strategy sessions. What I liked, other than I love them and they do a fantastic job, is one of the things that they did that's neat is they used a software, well, I guess an app is what you'd call it. It starts with a K, I'm almost positive of it. And what happens is they ask a question of the group. You do a QR code, and then, they give you like 30 seconds to a minute to put in your responses, and then it fleshes out into a word map. Totally cool, right? So instantaneous results. And so we started out with easy things, just to kind of get people talking, favorite food type of idea, all the way to what was the most important take-home point in the morning, what they wanted to discuss having to do with action planning, so they used it just at the right moments to re-engage every single person in the room, through that process. So that was really fun. And then we did get 4 actionable community outreach strategies, which were prioritized, and, put people on the spot just a tiny bit to volunteer to head up those strategies. So, since Champions for Health was running the summit, of course, we volunteered for the first one just to kind of get the ball rolling, right? And then other people would say, well, I'm not the decision maker. It's okay. You're not making a decision like I'm putting forth funding or whatever. You're going to be part of a meeting, and then you can bring in whoever you want after that towards these priorities that we're, working on. Next slide. So, some of the 4 actionable items is LTBI messaging, community gatherings, trusted messengers, and education to core staff, and to put it on a calendar. So it was interesting that this is what came out of it. My initial thoughts when we proposed doing the summit was, I like to see the cascade of care, the LTBI cascade of care, sort of as a continuum, right, of services from one end to the other, and that different providers, whether they're educators, outreach people, nurses, doctors, whoever, schools, whoever it might be, are within that process. But really, all of us are in each part of the process. We're just not realizing that we are, and what was important to me was to make sure that providers understood that educators are doing the right job, are sending people on. It's not just, oh, I educated them and they were miraculously decided that they wanted to go get tested, even if it's a cultural fit and all the rest. Sort of like our previous presenter mentioned, getting to a location to be tested. Do you have a home clinic? Do you not have a home clinic? So it's not just the messaging of LTBI, you might be at risk. Okay, now you have my attention. Now what do I do? So you have to have everything else in place as well. So these were some of the things that were decided that to organize the education part of it a little bit more. Okay, let's go to the next slide. So successes and challenges. So successes I put on the left, as you can tell with the pyramid in the normal shape. Community participation. Really, people were so excited to be there. Everyone was talking with everyone. When I did the welcome at the beginning, I did it in about 15 different languages. And I went up to people that were in the room saying, did I say that? You know, tell me how to say this. And I wrote it down, you know, to make sure that I didn't flub it. And people felt welcome. And people wanted to learn, wanted to get to the action planning, which is great. You know, out of the 155 people, we probably had maybe 95 that stayed to the very end. That's a big deal on a Friday. Let's just talk about, this was on a Friday. So that's a pretty big deal on a Friday. So community participation was high. Everyone was very, very excited to be there and to learn all the new stuff in the morning and in the afternoon. We had an action plan that was put in place with people volunteering. Really great, because you can have an action plan and prioritize it, but if you don't have the volunteers to kind of kick it off, it's hard to get people afterwards, right? I mean, email and stuff and phone calls. Everyone is busy, you know, the B word. So that was a very productive use of our time. And then it was a very broad spectrum of agencies in attendance. That was, you know, we went through a lot of different channels to promote, you know, the TBI for the county, TBEI for the county, the San Diego County Medical Society, which we're affiliated with, all of our email lists that we have as Champions for Health. And then I sent it out to colleagues saying, hey, you know, you're in diabetes, but folks who treat diabetes, your patients, you know, this could be useful information, have your providers come, and so forth, you know, to get the word out. So I really liked all the different groups of people who and agencies who were in attendance. From the challenges perspective, you know, the grant was 5 months, 6 months. It wasn't a full year, let's put it that way. And so we thought we had built in enough cushion, for example, physicians who are busy to get their PowerPoints together, to get it then approved for continuing medical education units and so forth. And it just felt like such a push. You know, it was frustrating. Luckily on the county side, the person who was our contact, you know, she just sat on folks basically in a nice way, you know, to get them to help and respond. You know, even though we were funded through T, we still had to get approvals through the county, because if the county logo is on anything in a co-host capacity, that needs to be approved. And it just wasn't happening fast enough for me, especially in a 5-6 month period. Let's just put it that way. But we got through it, and I do have more gray hair, and luckily you only see me on Zoom, so you can't see that close. Lack of free parking. So we thought the parking structure at the location would fit everybody. So literally in the last 2 weeks, the county made arrangements with the trolley station stop across the street, on the other side of the library across the street, with the market up the street and the coffee shop across the street, to allow people to park and not tow them. And so we had county people, you know, the county staff who were attending, go to those locations so that the parking structure that was closest and the street that was closest to the location, you know, folks who were just coming from all over could park. So, you know, the structure looked big, it was not. And then a number of survey responses. Again, you know, trying to get the survey approved and getting it out in a timely fashion was a little bit rough. I would have liked to have had 100 people at least respond. We had less than that. So that was a challenge, you know, getting enough people to respond to the post survey to see how it went. We got great feedback, but, you know, just to get enough feedback. Next slide. So lessons learned. The biggest lesson is you can be all about passion, but you got to keep your brain in it, right? So, bake in even more lead time for unanticipated delays. You know, we anticipated delays, but double it, you know, is what we learned from this. Double check logistics, have even more avenues and ambassadors for communication dissemination. And we found more after the fact that would help us with that. And then manage expectations of everyone involved, you know, the physicians, the partners, just it has to be managed. And one of the things that I really am proud of is that our facilitator who did the afternoon session really could read the room, you know, to go, okay, let's change it like this, let's do this, let's take a break, people need to eat, you know, let's do, and I think that that was really good, that, you know, we could have done another hour, but I think people would have been way too tired and would have just said, you know, and kind of might have zoned out. So managing the expectations of what's going to happen. And then, you know, it's the process. It's not, the process has to be as much as a success as the outcome of the event where people learned information and we have an action plan now and it's prioritized and so forth. The actual process to get there is just as important as the outcomes of the people learning and everything else. Thank you.